Welcome to today's episode, where we're going to discuss something that often doesn't get enough attention: testosterone and its role in women's health. Hi, I'm Dr. Pierre, a board-certified anesthesiologist and addiction medicine specialist. With extensive experience in the operating room and in both methadone and Suboxone clinics, I've dedicated my career to helping patients overcome the challenges of addiction and recovery. I also specialize in hormone replacement therapy, working closely with individuals to restore balance and improve their overall well-being. While this podcast is designed to share valuable information, it's important to consult your doctor for personalized medical advice that fits your unique health needs. You might think of testosterone as mainly a male hormone, but it's just as important for women. It plays a critical part in our everyday lives, influencing our energy levels, clarity of thought, and even our moods. Now, it's not just about building muscle or a deep voice. For women, testosterone acts almost like a conductor for a variety of essential functions, including cognitive abilities. In fact, there's a link between testosterone levels and how well we can remember things or find the right words. Even small decreases in this hormone can affect verbal fluency and other cognitive functions, which is pretty remarkable. While my blog discusses some general benefits of testosterone therapy in menopause, I want to draw your attention to a specific issue. One of the things that really stands out about testosterone therapy is how it connects to women's sexual health. According to guidelines from the International Society for the Study of Women's Sexual Health, testosterone can be used to treat low desire in women, particularly for those experiencing hypoactive sexual desire disorder, or HSDD. This condition goes beyond just a low sex drive. It's about an ongoing lack of desire that causes significant distress and affects overall well-being. HSDD can feel almost invisible, and it often doesn't get the attention it deserves. Yet it's more common than we realize, and that's where the guidelines for using a biopsychosocial model come into play. This model encourages healthcare providers to look at the whole person when diagnosing and treating HSDD. It's not just about hormones. Factors like stress, relationship dynamics, medications, and even past experiences all contribute to desire. So, what about testosterone therapy itself? When it comes to treating women, there's a preference for transdermal methods, patches, gels, and creams. These options help testosterone absorb gradually and consistently into the bloodstream, bypassing the liver's breakdown process, which can happen when taken orally. This more direct route provides a stable level of testosterone, which is essential for effectiveness and minimizing side effects. Research on transdermal testosterone is promising, especially when it comes to HSDD. Women have reported increased desire, greater sexual satisfaction, and less distress about their low desire. But like any medical treatment, there are always safety considerations. Most studies focus on short-term use, around 2 years, and the data looks reassuring. However, we still need longer-term studies to fully understand the effects. If you're thinking about testosterone therapy, the first step is always to talk to your doctor. It's important to find a healthcare provider who truly understands hormone management in women. Because there isn't an FDA-approved testosterone product specifically for HSDD in women, doctors often prescribe off-label, adjusting dosages meant for men to be safe and effective for women. This is why having an experienced doctor is key. When starting testosterone therapy, it's best to begin with a low dose and increase it gradually, monitoring blood levels along the way to ensure everything stays within a healthy range. Communication with your doctor is vital throughout the process, especially if you notice any changes or side effects like acne, changes in body hair, or mood swings. Before wrapping up, I also want to touch on DHEA, another hormone that sometimes comes up in discussions about women's sexual health. DHEA is different from testosterone, but it can be converted into both testosterone and estrogen by the body. While it may help with issues like vaginal dryness, its effectiveness in treating HSDD specifically isn't as strong. So, it's important to have realistic expectations about what DHEA can do. If you go to my website, frugaldoctor.com, you will find a detailed blog where I discuss DHEA further. Ultimately, raising awareness and breaking down barriers around women's sexual health is crucial. Women deserve the information and care they need to make informed decisions about their health. Remember, knowledge is power, and you have every right to advocate for your well-being. So, whether you're considering testosterone therapy for menopause or for your sexual health, remember that the key to success is having open, honest conversations with your healthcare provider. Ask questions, share your concerns, and take an active role in your care. Menopause is a significant transition, but with the right guidance from a knowledgeable provider, it can also be a time of positive change and growth. For those of you in Oklahoma, Texas, South Carolina, and Florida, I'm here to support you directly with personalized care and expertise. If you're ready to take the next step, don't hesitate to reach out. Thanks for listening, and stay tuned as we continue exploring fascinating new topics together.